Diphtheria, a resurgent threat. Once a childhood scourge, diphtheria remains a serious infectious disease, primarily affecting the respiratory system. This video will explore the complexities of diphtheria, from its origins to its prevention, providing a comprehensive overview of this potentially deadly illness. Diphtheria is caused by the bacterium Corynebacterium diphtheriae. This bacterium produces a potent toxin that is the primary culprit behind the disease's severe symptoms. Transmission occurs mainly through respiratory droplets, like those produced by coughing or sneezing, from an infected individual. Direct contact with infected skin lesions can also spread the bacteria, though this is less common. The diphtheria toxin, once released, travels through the bloodstream and wreaks havoc on the body. Its primary target is the cells of the upper respiratory tract, specifically the throat and nose. The toxin inhibits protein synthesis in these cells, leading to tissue damage and cell death. This damage causes the formation of a thick, grayish-white pseudomembrane that adheres tightly to the tonsils, pharynx, and larynx. This membrane can obstruct the airway, leading to breathing difficulties. Furthermore, the toxin can damage the heart, kidneys, and nerves, resulting in potentially life-threatening complications such as myocarditis, kidney failure, and neurological problems. Diphtheria was once a common childhood disease globally, but widespread vaccination efforts have dramatically reduced its incidence in developed countries. However, diphtheria remains a significant public health concern in regions with low vaccination rates, particularly in developing countries and areas with disrupted healthcare systems. Outbreaks can occur in populations with waning immunity or limited access to vaccination. Travelers to endemic regions are also at risk if they are not adequately immunized. The hallmark symptom of diphtheria is the formation of a thick, grayish, white pseudomembrane in the throat. This membrane can cause sore throat, difficulty swallowing, and hoarseness. As the membrane grows, it can obstruct the airway, leading to stridor, or a high-pitched whistling sound during breathing, and potentially suffocation. Other symptoms may include fever, chills, swollen glands in the neck, bull neck, and general malaise. In severe cases, diphtheria can cause complications such as myocarditis and inflammation of the heart muscle, which can lead to heart failure, neuritis, inflammation of the nerves, which can cause paralysis, and kidney damage. Diagnosis of diphtheria is typically based on clinical suspicion and laboratory confirmation. The presence of a characteristic pseudomembrane in the throat is a strong indicator of diphtheria. A throat swab is collected and sent to a laboratory for culture to identify the Corynebacterium diphtheria bacteria. A toxin assay may also be performed to detect the presence of the diphtheria toxin. Early diagnosis is crucial for prompt treatment and prevention of complications. Diphtheria doesn't typically have distinct types, but rather varying degrees of severity based on the extent of the infection and toxin production. Cutaneous diphtheria affecting the skin is another form, usually less severe and characterized by ulcers. Nasal diphtheria is another form of the disease. Treatment for diphtheria involves two main components: diphtheria antitoxin and antibiotics. Diphtheria antitoxin is crucial for neutralizing the circulating diphtheria toxin. It must be administered as early as possible, ideally within the first 48 hours of symptom onset, to prevent further damage to the heart, nerves, and kidneys. Antibiotics, such as penicillin or erythromycin, are used to kill the Corynebacterium diphtheria bacteria and prevent its spread to others. Supportive care, including airway management, is essential for patients with severe respiratory obstruction. Patients with myocarditis or other complications require specialized medical care. Prevention is the cornerstone of diphtheria control. The diphtheria vaccine, typically administered as part of the DTaP diphtheria, tetanus, and pertussis or TAPS, tetanus, diphtheria, and a cellular pertussis vaccine, is highly effective in preventing diphtheria. Routine childhood vaccination is crucial to establish immunity. Booster doses are recommended for adults to maintain protection throughout life. In addition to vaccination, good hygiene practices, such as frequent hand washing and covering coughs and sneezes, can help prevent the spread of the bacteria. With prompt diagnosis and treatment, the prognosis for diphtheria is generally good. However, delayed treatment or severe complications can lead to significant morbidity and mortality. Recent research focuses on improving diagnostic methods, developing more effective antitoxins, and understanding the mechanisms of toxin-induced tissue damage. Studies are also investigating the long-term effects of diphtheria on the heart and nervous system. Ongoing surveillance and vaccination efforts are essential to maintain diphtheria control and prevent future outbreaks.